Hi, my name's Alison Stewart. I'm the lead practice manager for West Leeds PCN. Our PCN is approximately 70,000 patient capitation, and within our PCN we've got 48 staff. And I'm going to talk to you today about specifically recruitment and retention of the additional role reimbursement staff. So right back at the beginning of PCNs, we spent quite a lot of time looking at our population health data to actually see what we needed. In the early days, as you will know, it was quite unusual for dietitians, occupational therapists to be working directly in primary care. So we wanted to be clear what roles we actually needed for our population in order to recruit. And before recruiting, we were very clear on roles and what was expected of the staff. After we've recruited, we spent quite a lot of time actually working out the detail of the job description, because these staff were new to GP world and we wanted them to come and know what they were doing. As well as growing the job, they needed a basis to start with. Where possible, we actually recruited 2 people into a role, because it's quite isolating working within a primary care network if you're the only member of that discipline. Other things that we have done to try and retain is make sure we've got really good management and leadership structures. So each of our teams has got a team leader. The team leader then manages the staff underneath them, and that includes making sure we deliver 6 monthly reviews, annual appraisals, monthly MDT meetings, and again that increases that feeling of being part of a team and not in isolation. Our primary care support workers spend some time in practice delivering things like NHS health checks. So that's got the added benefit of embedding them in the practices and also supporting the practices to secure additional funding, such as the money that comes from NHS health checks. Learning disabilities is another example of that. We have physicians associates who undertake learning disabilities health checks on behalf of the primary care network, and the funding for that then goes to the practices. So there's a constant review of what benefits the primary care network, what benefits the practices, and it's a balance that we look at all the time. As you'll be aware, the PCN contract runs for 5 years. So at the end of this financial year, 2023-24, we are aiming to maximise all of the available funding, and then that becomes recurrent. The benefit of that is that increases the health care we can deliver to the population, to the local population. Approximately 76% of patients we know from NHS England need to be seen by a GP, the remaining other patients don't. So we can use the staff to take the workload away from the GP and actually look at the sort of wider determinants of health. So further down the line, hopefully that prevents patients worsening with their long-term conditions. So a good example of this is our frailty team. So we have a frailty team who work with us who are moderately frail, and they make sure that they put in place care so that the patients don't deteriorate, which then impacts on the GP and on secondary care.